Dear friends, followers of SXNM TV, once again, thank you so much for following our channel. Today we are going to talk about a disease which is seeming to be strange because many countries in the world this disease is not known. It is called Parkinson's disease. Parkinson's disease. Parkinson's disease, also known as paralysis agitans or shaking palsy, is a serious chronic disease of the nervous system. It is characterized by stiffness of muscles and a continuous tremor or shake. It is a disease of extrapyramidal system. So this disease, we are going to see another description beside this to see different researchers who did the research on it, and we can well understand. Before we go to symptoms, let's check another description and let's see. The second description, it's in fact in the second reference, here they say, what is Parkinson's disease? So what exactly is Parkinson's disease? Is known as PD. PD is a type of movement disorder that can affect the ability of, to perform common daily activities. Although Parkinson's disease is associated with a wide range of symptoms, there are features of Parkinson's disease that most people with the condition will experience. These symptoms are typically divided into those that affect movement, motor symptoms, and those that do not, no motor symptoms. The most common motor symptoms of Parkinson's disease are tremor, or a form of rhythmic shaking, stiffness of or rigidity of the muscles, and slowness of movement called Bradykinesia. Bradykinesia. A person with Parkinson's disease may also have trouble with posture, balance, coordination, and walking. Common non-motor symptoms of Parkinson's disease include sleep problems, constipation, anxiety, depression, and fatigue, among others. You will learn about the motor in the next chapter. It is important to note that although there are common symptoms of Parkinson's disease, they can vary greatly from person to person. Moreover, how these symptoms change over time and whether other symptoms of Parkinson's disease emerge differ from person to person. Most people who develop the symptoms of Parkinson's disease do so sometime after the age of 50. But Parkinson's disease can affect younger persons as well. There are an estimated 1 million Americans living with Parkinson's disease and more than 10 million people worldwide. Well, still looking for the symptoms. Description of disease originally given by Dr. James Parkison of Shoreditch in 1817 is as follows: involuntary tremorous motion which lessened muscular power in parts not in action, and even when supported, with a propensity to bend the trunk forwards and to pass from a walking to a running pace. The senses and the intellect being uninjured. The patient shows a combination of tremor of the limbs and muscular stiffness. These tremors or tremors are more noticeable when the patient is at rest and tend to disappear when they attempt to move or when he is asleep. The tremors are more pronounced when he is excited or fatigued. Older patients occasionally exhibit involuntary rapid jerking movement of the arms and the legs. In a less extreme form, the condition presents as purposeless mastication and lip smacking movements. The condition is embracing both to the patient and his relatives, but is not associated with mental impairment and rarely causes severe incapacity. Later, there may be impairment of speech, and the patient may complain of cramping pains in the back because of muscle spasm. His mind usually remains clear, and his other sensations are normal. In many cases, the patient may have only a mild form of Parkinson's disease and continue this way for many years before any serious symptom develop. In severe and advanced cases, however, the patient is not able to move and presents a distressing spectacle, for his mind may be uninjured while he cannot speak or write. We are still describing how Parkinson's disease affected the brain. Parkinson's disease is a neurodegenerative disease. There is loss of neurons, nerve cells, in certain areas of the brain, including a region called the Substantia nigra, Substantia. That is in Latin. For black substance, the neurons in this region, which appear dark under a microscope, produce a neurotransmitter, a chemical messenger that allows neurons to communicate, called dopamine. Dopamine helps to regulate movement. As the number of cells in the Substantia nigra decreases, there is less dopamine available in the brain. Dopamine is important to maintain normal movement patterns. This loss of dopamine is the reason that many treatments for Parkinson's disease are intended to increase dopamine levels in the brain. Treatment of Parkinson's disease will be explained in more detail as we continue. Loss of neurons in other parts of the brain also occurs in Parkinson's disease and account for some of the non-motor symptoms of the disease. Now let's see the causes. The brain changes that lead to Parkinson's or Parkinsonism are not fully understood. It, however, appears that they involve the nerve cells containing melanin. Melatonin, not melanin, it's melatonin. The pigment, what's melanin? That gives the skin its color. These cells, called Substantia nigra, are concentrated in the part of the brain called the basal ganglia. As the cells deteriorate, production of dopamine, a chemical that carries messages within the brain, falls, and the result is the characteristic symptoms. Parkinson's disease may follow severe attacks of encephalitis, that is inflammation of the brain, or some type of poisoning, such as carbon monoxide. In older patients, this type of paralysis may be due to hardening of the arteries in certain vessels leading to the brain. In most cases, however, the disease begins to show itself in later middle age and is considered to be a consequence of degeneration, particularly in the basal ganglia. Parkinson's disease may also result from deficiency of antioxidants, vitamin E, earlier in life. According to Dr. Lawrence Gorby, MD, a neurologist at the University of Medicine and Dentistry of New Jersey, too little vitamin E foods earlier in life may somehow leave the brain vulnerable to the onset of Parkinson's years later. In most cases, the cause of Parkinson's disease is unknown. So let's go in theories now. We're looking in general, but we're going in theories of the cause. Okay? Theories about cause. The cause of most cases of Parkinson's disease is still unknown, although scientists believe that both genetic and environment interact to cause Parkinson's disease in most people who have it. Currently, there is an enormous amount of research directed at the producing more answers about what causes Parkinson's disease and how it might be prevented or cured. When physicians diagnose Parkinson's disease, they often describe it as idiopathic. Idiopathic. Okay? This simply means that cause of Parkinson's disease is unknown, is not known. That's what it means, idiopathic. There are severe genes that, when mutated, can increase the risks of Parkinson's disease. One of these, called LRRK2, is particularly frequent in families of North Americans or Ashkenazi Jewish descent. Mutations in the alpha-synuclein gene have also been found to trigger Parkinson's disease, but these are quite rare. Other genes that contribute to Parkinson's disease include the GBA genes, gene, that Parkin gene, the Parkin gene, and the DJ-1 gene, DJ-1 gene. However, in the large majority of causes, no primary genetic cause can be found. As studies of Parkinson's disease continue, it is likely that more genetic risk factors will be discovered. In addition, as medications are developed that target specific gene mutations, it will become increasingly important for individuals with Parkinson's disease to understand the particular genetic profile. Now, there is what we call environmental factor. We're talking about genetic factor, so let's see to environmental factor. Certain environmental factors, such as significant exposure to pesticides or solvents, and repeated head injuries, can increase the risk of Parkinson's disease. Most people do not have a clear environmental cause for the Parkinson's disease, and because many years can pass between exposure to an environmental factor and the appearance of Parkinson's disease symptoms, the connection is often difficult to establish. However, it seems likely that environmental factors do not influence the development of Parkinson's disease, perhaps particularly in people who also have a genetic susceptibility or risk factors. Some environmental factors are associated with a lower risk of Parkinson's disease, such as exposure to caffeine and exercise. More on exercise later. Further information about other risk factors. There are other things that put an individual at higher risk for developing Parkinson's disease. The main risk factor is age, because Parkinson's disease is more common in older adults above 50 years of age. Men also have a higher risk of Parkinson's disease than women. Parkinson's disease seems to affect Caucasian more often than African American or Asian. The actual links between any of these factors and Parkinson's disease are not completely understood. Now that you know a bit more about what Parkinson's disease actually is, the following chapter will provide greater details about what to expect in terms of symptoms. Symptoms, we have talked about them in short, but we are going to enlarge. This chapter described the most common symptoms of Parkinson's disease. Remember, once again, that although there are typical symptoms of Parkinson's disease, these can vary greatly from individual to individual, both in terms of the intensity and how they progress. Motor symptoms generally involve movement, while non-motor symptoms do not. Motor and related symptoms of Parkinson's disease. There are 5 primary motor symptoms of Parkinson's disease: tremor, rigidity, bradykinesia, slow movement, postural instability, that's balance problems, and walking gait problems. Observing one or more of these symptoms is the main way that physicians diagnose Parkinson's disease. Tremor. The characteristics tremor in Parkinson's disease is a slow, rhythmic tremor that typically starts in one hand, foot, or leg, and can eventually affect both sides of the body. Tremor can also occur in the jaw, chin, mouth, or tongue. The classic tremor or Parkinson's disease is a resting tremor, which is the strongest when the affected limb is at rest, and may become less apparent or even disappear during a purposeful movement. An action tremor, or a tremor that occurs with intentional movement, may also be a feature of Parkinson's disease. In addition, some people with Parkinson's disease can experience a feeling of internal tremor, which is not necessarily noticeable to others. Only the patient feel it inside the body. Essential tremor is a neurologic movement disorder in which tremor is a major symptom, where the tremor is typically an action tremor rather than the resting tremor of Parkinson's disease. Essential tremor is a different disorder than Parkinson's disease, but is sometimes mistaken for it, especially early in the disease. Because resting tremor is A hallmark of Parkinson's disease, its presence, at least in some form, is a strong clue for the diagnosis of idiopathic Parkinson's disease. However, there are other types of tremors that can be easily mistaken for the tremor of Parkinson's disease, and conversely, about 30% of people with Parkinson's disease never develop a tremor. It is also important to note that if a person experiences symptoms of Parkinson's disease, other diagnoses may be possible, including other movement disorders, especially if he or she does not exhibit the characteristics tremor of Parkinson's disease. Disorders that have some of the motor signs and symptoms of idiopathic Parkinson's disease are called Parkinsonia syndromes, or Parkinsonism. Therefore, it is crucial to consult with a physician who has specialized training in neurologic movement disorders to assess the quality of any recurrent or persistent tremor. Now, I want to see rigidity. Rigidity refers to a tightness or stiffness of the limbs, that is, either legs or arms or torso. Rigidity, especially in the early stages of Parkinson's disease, may be wrongly attributed to arthritis or orthopedic problems such as a rotator cuff injury. Now let's see the bradykinesia. Bradykinesia, Greek for slow movement. Bradykinesia is a frequent symptom of Parkinson's disease and related movement disorders. In addition to a general slowness of movement, the bradykinesia of Parkinson's disease is typically demonstrated by a reduced or mask-like expression of the face, that is hypomimia. A decreased blink, rotate of the eyes, and problems with fine motor coordination, for example, difficulties buttoning a shirt. Having trouble turning over in bed, and a slow small hand writing, micrographia, are other signs of bradykinesia. Postural instability. More pronounced in the later stages of Parkinson's disease, postural instability includes the inability to maintain a steady upright posture or to prevent a fall. Such balance problems in Parkinson's disease are associated with a tendency to wrist or fall backward retroversion. In fact, a light push can cause the individual with Parkinson's disease to continue slipping backward or to even fall down. Prominent postural instability early in the disease may indicate that the correct diagnosis is one of the other Parkinsonia syndrome rather than Parkinson disease, walking or gait difficulties. Bradykinesia and postural instability both contribute to walking or gait difficulties in Parkinson's disease, particularly as the disease progresses. A common early symptom of Parkinson's disease is a decrease in the natural swing or of one of both arms when walking. Later steps may become slow and small, and a shuffling gait may appear. Gait problems in Parkinson's disease can also include a tendency to propel forward with rapid short steps. That's called fascination. People with advanced Parkinson's disease may experience an episode of freezing in which the feet feel as though they are glued to the floor. Vocal symptoms. In addition to the core motor symptoms of Parkinson's disease, changes in the voice are common. Generally, these are believed to be at least partially due to bradykinesia. In Parkinson's disease, the voice may become softer or it may start off strong and then fade away. There may be a loss of normal variation in volume and emotion in the voice, so that the individual may speak in a monotone. In more advanced Parkinson's disease, speaking may become rapid with the words crowded together, or stuttering may occur. It is beneficial to see a speech language pathologist, SLP, in order to address any emerging communication difficulties as early as possible. You can find a SLP by visiting this some websites. LCVT ROUD is an effective voice treatment program that involves the training of vocal use and increasing the voice volume. For more information, you can go to internet and find details. Other issues you can tell you, there is non-motor symptoms. There is disturbances in the sense of smell. There is sleep problems, insomnia. There is depression and anxiety. There is fatigue. There is cognitive decline, weight loss, gastrointestinal issues. Those are no symptoms of Parkinson's disease. There is lightheadedness. There is urinary issues. There is sexual concerns. Changes in sexual desire or libido is another non-motor symptoms of Parkinson's disease that is often under recognized sexual desire, may be reduced in some cases because of complex psychological issues. So there is also sweating is another issue. There is a melanoma. Individual with Parkinson's disease may have an increased risk of melanoma, a serious type of skin cancer. So those were some other issues we can tell you in this presentation. Now let's go in a short talk about possible natural treatment which can help. That plays an important role in the treatment of Parkinson's disease. To begin with, the patient should resort to a short juice fast for 5 days. In this regime, he should take a glass of fresh fruits or vegetable juice diluted with water on 50-50 basis every 2 hours from 8 a.m. to 8 p.m. Fruits and vegetables which may be used for juices are apple, pineapple, grapes, orange, tomato, carrots, cabbage, and spinach. A warm water enema should be used daily to cleanse the bowels during the period of fasting. After a short juice fast, the patient may adopt a no-fruit diet for further 5 days. During this period, he should take 3 meals a day of fresh juice fruits such as apple, pear, peach, papaya, grapes, orange, and pineapple at 5-hourly intervals. Thereafter, he may gradually adopt a well-balanced lacto-vegetarian diet. The emphasis should be on raw seeds, nuts, and grains. Especially nuts, we can tell you about the nuts. They are almonds, cashew nuts, and walnuts. Those are very important. For the seeds, pumpkin seeds, sesame seeds, and even flax seeds and karonji. So that one should consume also grains, plenty of sprouts, raw milk, preferably goat's milk, and raw fruit. As I said, raw fruits and vegetables are very important. And sesame, as I said, also are important, especially sesame and butter made of it because of the protein contained. The patient should avoid tea, coffee, chocolate, salt, spices, condiment, pickles, fresh foods, white flour and white sugar, and all products made from them. He should also avoid all processed tinned, canned, or frozen foods. The short juice fast followed by all fruits should be repeated at monthly intervals till condition improve. Dear friends, followers of SLKSNM TV, vitamin E also is important for these people. So please pass the message to everyone. This is SLKSNM TV.